Welcome back, everybody. Our coverage of the coronavirus crisis continues. We want to give you some of the broad strokes of what's happened today. We've just learned that President Trump will address the nation at 9 p.m. and the NCAA tournament, March Madness, will be played without fans.
Really difficult to even quite grasp what that's going to look like. But we, of course, again, joined by Dr. Frank McGeorge. Before you start the headlines, a couple of other things to follow up on what we just heard from the governor. I just got a tweet, and I think a lot of people are wondering this. Why aren't the cities involved mentioned? For one, I'd really like to know Oakland and Wayne counties aren't exactly the smallest counties.
Right.
And clearly, we've got a HIPAA issue here and patient privacy to deal with, but you're trying to marry that with public interest and public safety.
Exactly. I mean, I think releasing the city that the individuals lived in is probably reasonable because that does not narrow it down by a great deal, and that would give people some level of confidence about the information that's being delivered. Unfortunately, they've chosen not to release that information at this time. Other localities have released the city and the neighborhood even, and that's, you know, we've seen that in other instances. In this particular case, they're choosing not to release that.
The other thing, quickly, there's going to be some that say, look, there's just 2 cases in the state. This is an elephant gun approach to what is something that right now still looks fairly modest.
Right. Well, the only thing is these 2 cases are really kind of canary in the coal mine issues. We believe that there probably are more cases already in the state of Michigan. They just have yet to be identified. And ultimately, at this point, it's a matter of further testing, broadening the scope, and identifying people and identifying how much community spread there is, because there likely is some community spread.
And the World Health Organization is officially now calling this a pandemic, and the response to these positive tests, would you say, has been really swift?
Oh, yeah, definitely. I mean, I think the governor and you know, Dr. Khaldun have made great strides in trying to limit, you know, the amount of community connection, that is, try and encourage or discourage, I should say, large gatherings, try to get people to practice better hand hygiene, et cetera. So those are definitely things that we need to think about. Now, we've reached the point where this is going to cause disruptions in our everyday lives, and we are already seeing a ripple effect of cancellations and closings. Take a look at this video today from the Costco in Roseville. They've been busy all day with people stockpiling or stocking up on supplies. The new level of concern comes after the state confirmed the first 2 positive cases of coronavirus here in Michigan.
We've had the first positive test of coronavirus identified here in Oakland County.
Oakland County officials say the patient, a middle-aged woman, had traveled to a country that did not have any reported cases at the time. What happens next is finding out who she's had contact with.
What we're doing is the contact investigation, isolating this person, making sure that they continue to be well cared for, and following up on any family members or other contacts since return.
While these are the first cases to be confirmed, health officials made it clear they expect more.
This is not likely to be our last case here in Oakland County. It's likely in the community.
The Wayne County patient is a middle-aged man who traveled within the United States.
Be prepared, be aware, and get the right accurate information so that you know what best you can do to protect yourself and then protect the residents of Wayne County.
Especially those who are older or who have other serious health conditions.
Seniors are the highest risk population, so our initial push is to get that information out to the seniors.
They urged everyone to take precautions and sought to offer reassurance.
While this virus is new, our response to it is not. This is what our great professional healthcare people do.
We have been preparing for this. This is what we do.
Now, we are currently awaiting the results of 18 more pending tests that are being run at the state lab today. Now, while I know everyone wants to know exactly where these first 2 patients live and have been, it's really important to realize that there are, frankly, more cases likely out there in the community, and everyone, regardless of where you live, does need to pay attention and start taking appropriate precautions if you have not already been doing so.
Kind of the definition of community spread. You stop trying to follow all these threads back to see what airport and all, right?
Exactly. At this point, it's really about mitigation. We are trying to limit the spread and the speed of spread. That's what it comes down to right now.
Indeed. Okay, we'll have more from you throughout the newscast and again at 6. Thanks, Doc.